So osteoarthritis, it is the most common form of arthritis. It is characterized by damage to the articular cartilage. So cartilage reduces, bone and synovium increases. So new bone formation and remodeling of the joint. Inflammation is not a prominent feature of osteoarthritis. Next, epidemiology. So aging, prevalence increases with aging. So it mainly affects the weight-bearing joints, so knee and hip. Okay, small joints can also be involved. Okay, so etiology and pathogenesis. See, it is more common in females. Okay, so etiology and pathogenesis. See, it was previously thought to be a normal consequence of aging, thereby leading to the term degenerative joint disease. Now it is realized that multiple factors play a role in causation of OA, so it is multifactorial. So I like to remember it as sporty, old, obese females with occupation of repetition and muscle weakness. So they play sports, old age, obese, female sex, occupations, a repetitive occupation, weightlifting and all that, shipyard workers especially, and muscle weakness. Okay, genetic factors as well. So many insults such as trauma, repetitive loading, metabolic, genetic or constitutional insults may damage a synovial joint and trigger the repair process. Repair process involves new bone formation and remodeling of the joint. So new bone formation occurs at the margins of the joint and it's called osteophytes. This may result in anatomically altered but pain-free functioning joint. Okay, it is compensated osteoarthritis. But poor repair process may result in progressive symptoms and joint failure. Okay. So pathologically, there is fissuring of the articular cartilage surface. See, if this is a bone, okay, and this is another bone, okay, this is the articular cartilage, okay, the articular cartilage. See, this articular cartilage, first there is fissuring, okay, like this. Then there is fibrillation, okay, development of deep vertical clefts. So the cartilage, the chondrocytes, they undergo death, okay, so localized chondrocyte death and decrease in the cartilage thickness, so this causes decrease in the joint space. So the bone immediately below the articular cartilage, it develops osteophytes, it increases in thickness, it develops cysts. Okay, and synovium also undergoes hyperplasia. And clinical features. So main symptoms are pain and restriction of joint movement. Pain is of insidious onset, okay, over months or years, especially more on the weight bearing joints. Okay, so you have good days and bad days. It is intermittent over time, and again it is worse on movement and weight bearing, relieved by rest. So in treatment you ask the patient to take rest during acute attacks, and morning stiffness is less because after rest you are getting up. Okay, and then examination of the involved joint, you can see restricted movement, again coarse crepitus, okay, bony swelling, osteophytes, joint deformity and joint line tenderness. Okay, so you can't move. If you move, you'll find crepitus, you'll find a swelling, joint deformity because of the swelling, and joint line tenderness, and muscle wasting is present around the involved joint because you're not able to move properly, so disuse atrophy. Next, generalized osteoarthritis involves multiple joints. It starts at the interphalangeal joints, distal, then proximal. So, and these affected joints, they develop posterolateral swellings on each side of the extensor tendon. Okay, so they become, so if it is distal interphalangeal joint, you'll have Heberden's nodes, and proximal you'll have Bouchard's nodes. And then investigation, CSR, CRP are normal. Plain X-ray, you can see osteophytes and joint deformities. Synovial fluid analysis, because of advanced age, you might have pseudogout, so calcium pyrophosphate crystals may be seen. And non-pharmacological therapy, again you advise rest, okay, reduction of risk factors, so weight loss, use of walking stick in painful knee. Okay, physiotherapy. So pharmacology, again give analgesics, pain management, so paracetamol, then oral NSAIDs, diclofenac, etc. Steroids, intra-articular injection can help. And surgical therapy, if there is severe pain and functional impairment, so you can go for osteotomy or arthroplasty or joint replacement, arthroscopic debridement, etc.